Medical-Prolotherapy and stem cell therapy. Both are concepts in the health industry that may be new to you. That's why I'm so happy to welcome to the show this morning Dr. Ross Hauser. He is a prolotherapist at Caring Medical Center. Good morning, doctor.
Thanks for having me, Carly.
You're also an author. Your latest, An Alternative to Knee Surgery, Prolotherapy. So again, I love that we're talking about a concept that I think may be relatively new to some people. So let's go ahead and jump right in and kind of explain what prolotherapy, and again, when you hear this term stem cell therapy, kind of how do they relate and how do you explain what it is?
Yeah, stem cell therapy actually is a type of prolotherapy. Carly, prolotherapy is an injection technique that stimulates the repair of painful areas. So when you have, like, say, a knee, so this is a model of a knee joint, you know, and this white stuff here is the cartilage. When the cartilage breaks down, it means that there's not enough cartilage cells to repair the area. So, you know, like in Southwest Florida, when you have a building project and there's not workers at the construction site, not much gets done.
Yeah.
So as you and I age, and as the joint degenerates, there's less and less cells to repair the joint. So prolotherapy and stem cell therapy is us either attracting cells to the area to repair it, or with stem cell therapy, we're getting cells from your blood, from your adipose or fat tissue, or your bone marrow, and we're injecting those cells like into the knee joint, into the hip joint to stimulate
talk about that,
repair.
because we're talking about, you know, just an example is this may be an alternative to knee surgery, but really whether it's your elbow or anywhere where you have a joint, essentially, right, that people are struggling with pain, prolotherapy may be an option to help with that pain.
Yeah, when you're having pain in a joint, especially if you're older, you know, I'm not a spring chicken anymore either, but no, I'm considered a senior. I'm over 50. So what happens is, again, you don't have a lot of cells that are going to repair because the aging process makes less and less cells in there. And as you get the breakdown of cartilage, you need more and more cells to stimulate repair. So one method to stimulate repair is for us to actually inject the cells in there. So how you determine whether or not you're a good prolotherapy candidate or stem cell therapy candidate, Carly, is how is your range of motion? Like, if your range of motion is relatively still pretty good, that means the architecture in the joint is still preserved. You may have bone-on-bone arthritis, but there isn't major bone spurs limiting motion. So if you have decent motion, normally you're a good candidate for prolotherapy and stem cell therapy. In other words, the results are going to be very good.
Well, and I love that your office, you and both Dr. Special are very, very honest, and that you really want to make sure that you are choosing candidates that this, you know, is going to have a good chance in working. This may not be for everybody, but I think if somebody is looking at possibly facing any type of surgery for that matter, whether it's knee surgery or anything else, you know, find more about prolotherapy, right?
Most people would know, especially athletes, that you actually don't want to get a surgery if you don't need it. So surgery, to me, should always be a plan B or a plan C. Prolotherapy is a natural injection treatment. We try to use as natural substances as possible, so the basic solution has dextrose, the normal sugar in the body. We can also use some hormones or fatty acids. And then if the condition is really severe, like bone-on-bone arthritis, that would mean that we actually have to have cells that will turn into cartilage cells. So the reason to do stem cell therapy, in other words, take out the stem cells from your bone marrow or your fat, is because we want those cells to turn into cartilage cells. Stem cells can turn into other cells, and they're starting to use stem cell therapy for the heart, for the liver, for, you know, a lot of different.
It's exciting to see where, where this is going. Well, before we close, I know you also wanted to mention, you know, as far people are very curious about the cost, and I love that you are trying to really make this affordable for people. I know a lot of people to say, okay, does Medicare cover this? It doesn't, you know, cover it, but you say it is still affordable. Yeah,
prolotherapy runs in the hundreds of dollars. It's not thousands of dollars. And Carly, most people who see us, they've already tried Medicare-covered procedures, so now they still have chronic pain. They're quality of life is way down. So prolotherapy is definitely an option, affordable. It works really, really well.
Well, as we close here, what is the best way to figure out, number one, if you're a candidate? Again, the results are going to be vary between everybody as well. What's the best way to maybe find out more, see if this would be an option that somebody should go down that road?
I would really recommend people who are on Facebook just go to Caring Medical's, Friends of Caring Medical's Facebook page, because there's like thousands of people on there that have had prolotherapy, so you could talk to them. Or else go to www.caringmedical.com, because we have almost every medical condition in there and whether or not prolotherapy works for it or not.
So that's a good starting place. Go to the website. Again, I know you've had a lot of videos there, a lot of research done. I know you've written a lot of books about this. This is your passion. You love helping people get that quality of life back. So we love that you're here. Thank you so much. And
Thanks for having me on.
For more on Caring Medical Center, all you have to do is go to their website, or of course our website as well, fox4morningblend.com.
We're going to grab one last look at your Fox forecast, and then we'll be right back.